All right, welcome everyone. After a little bit of technical difficulty, I believe we are ready to go. We have figured out what the issue is and we're ready to press forward. So today we are focused on innovation in healthcare, and we are looking at a variety of different ways to support this greater concept, to go well beyond just delivery options and insurance choices, to think about our disabled communities, to think about our vets, to think about our disadvantaged communities, to think about new ways, the concierge medicine, if you will, and individualized medications. There's so many things that are happening that are exciting in healthcare, and we want to make sure that we are highlighting them here and really looking at these issues holistically. Today we're focused predominantly on preventative healthcare and making sure that we are trying to help people have a healthy lifestyle long before we end up in problem situations. Even when we have illness and things are occurring that we don't expect, when our bodies are healthy and ready to go, we are much stronger to fight them. So I'm excited to say Chris Bennett, our guest today, has just joined, and we will go ahead and bring him into the conversation. And I think we're going to be ready to go. We've had a few runs at this, but I think it's ready now. Chris, great to have you
Wow.
on.
Okay, success.
Success. Yes, noteworthy to the Facebook community. There are a lot of little tricks and tips and problems, and in this case, we got tripped up by a watch party versus a watch video. So know the difference and troubleshoot accordingly, which is how it tends to go. So Chris, without further ado, because we are a little late starting, I'm going to go ahead and turn it over to you. I've done a little intro as to what it is that we are talking about today, and I would love to just allow you to introduce yourself and highlight the key points, because you have a long career in this area, that you really want to focus on today.
Great. Okay. Well, let's see. You mentioned that we're going to be talking about healthcare. So my background is I got started about 20 years ago working with my father, and he was a professor of medicine at UCLA for 35 years. And he was a pioneer in the field of healthy living and prevention. He, back then, back in the 1970s, he was the founding medical director of the Pritikin Longevity Center, which is probably the longest profitable healthy living program in the world. And it's now in a Trump-owned hotel on Miami Beach. And unfortunately, when my dad was working there, I didn't care about these things, so I didn't really check it out or anything. And then he wrote this book called In 12 Weeks, You Can Control Your High Blood Pressure Without Drugs. And it was published by Doubleday and endorsed by professors at Harvard and UCLA and Stanford. And so I was totally oblivious to it, like probably most Americans. I didn't read his book, but then around 2000, my dad developed atrial fibrillation, which is a life-threatening fast rhythm of the heart. And so the doctors put him on drugs, and over the next year, it didn't get better, and the doctor said he might need heart surgery. So I got alarmed, and I started going to UCLA's medical library and reading all about his condition. And I ended up coming back to him with a 2-inch stack of studies that said it was caused by stress. But his doctors hadn't told him that. And so he was working 70 hours a week, taking care of patients at 7 critical care nursing facilities where people are
Wow.
dying, seniors. And so he immediately retired, and we created a foundation called No More Medicines, which is about prevention instead of pills. And so then I worked with him to update his book, and we reprinted it and published it on our own. And then at the same time, I'd been volunteering for the Los Angeles Police Department in a program I helped bring to the city called the Trauma Intervention Program. And they provide volunteers if somebody dies, then the police or fire department can call and a volunteer will show up within 30 minutes, 24 hours a day
Wow.
to give emotional first aid to the family of the person who died.
I like that term, emotional first aid. We don't think about that very often, but it is incredibly important.
Yes, it is. So after going out on some calls where there was a body, somebody had died, I went out on a
Hmm.
few calls. I developed severe anxiety. And so I went into work and I had this severe fear that I was 5 minutes late and they were going to fire me. And I was panicked about it. And
Mm.
so I didn't know what was going on. I didn't even understand what the concept of anxiety was. So I was going to UCLA and I started reading about stress and health and post-traumatic stress. And I
Hmm.
ended up reading and copying hundreds and hundreds of studies about these things. And so I ended up with this big library. Ever since then, I've been buying books on Amazon, and I ended up with this huge library on health from the top experts in the world on these issues. And so my mission has been to get their information out to the world
Hmm.
and into the healthcare system.
Yeah, because anytime we can prevent, it is so much easier to deal with issues than on the back end in a treatment sort of scenario. And I think your point on stress is one, oddly enough, we can't stress enough. I used to have coffee at our local coffee shop. Okay, I'm going to admit every morning. And so I ended up
Mm-hmm.
with almost this group of folks that I would frequently talk with, and we would chat, particularly over these issues. And one of the gentlemen one time said, you know, JJ, something we all need to learn is that stress kills. And of course, he's playing off the phrase smoking kills. And I looked at him, I said, sir, someday I'm going to say that in an interview because that almost needs to be a t-shirt. Stress kills. And it's that serious. The impact is so, it's so far reaching and so intense on the body. And we don't think of that in healthcare. We think about treatment, not prevention. So I love
Mm-hmm.
your comment. What was it? Prevention, not pills?
Yes.
Yes, yes. I
Mm-hmm.
like that. I like that a lot. So talk to us about what steps you've been taking recently to start sharing that message.
Well, for probably 100 years, the health researchers and the psychosomatic experts have been saying that stress causes 70% of illness, but it's kind of vague. People don't really
Mm.
understand how. So what I've been able to do is figure out exactly how and explain it in uh, so that anybody can understand it. So my dad worked with thousands of patients to help them get healthy, but uh, he could never understand why people would get healthy. They would start living healthy in the program
Mm-hmm.
when they were living in a hotel for a month, exercising and eating right. That's what the Pritikin program is. But
Sure.
then when they return home, they return to bad habits.
Classic Hawthorne effect. Yes.
Yes. So doing the research and doing big picture analysis, I realized that bad news stress turns off happy chemicals in our brains. Then we turn to junk food, nicotine, alcohol, and illegal drugs to turn them back on.
Correct. I mean,
So
that's the
that
basic explanation. Yeah. Yeah.
so that explains half of illnesses.
Yeah. It's a huge portion. Yeah. It's very impactful.
And then a symptom of stress is fatigue.
Mm-hmm.
That's something that Hans Selye, the most important stress researcher, figured out
Mm-hmm.
50 years ago. A symptom of stress is fatigue, and so people don't want to exercise when they're tired.
Right.
And with the happy chemicals off, we don't enjoy exercise.
Right.
So the doctors aren't saying that, and that's not generally known by the public. Why don't I want to exercise? You know, anybody would love to, everybody knows they should exercise, but they don't love it.
Right.
They love junk food, nicotine, alcohol, and illegal drugs. So they do
Self-medicating
those,
is,
you know?
yes. Well, self-medicating is a quick response, right?
Yeah.
And working out is a long response, and self-medicating is also easy. It requires no stress or strain.
Yes. Yes. And then I also subsequently, I figured out with each illness, the top illnesses, how stress leads to that in a way that's unique. So like hypertension,
Hmm.
which 50% of American adults have right now,
Wow.
and 95% of us get hypertension as we get older. Hypertension is a symptom of toxic stress overload or post-traumatic stress. And then Alzheimer's, well, when you're under a lot of stress, the blood doesn't go to your brain as well. And so it's the cells are not getting oxygen and maintained. So like, have you heard the saying cold feet? When you're scared, your feet get cold?
Yes.
Okay, that's when you're under stress, the blood doesn't go to your feet. It restricts.
Right.
It's the same thing with your brain and your eyes and your kidneys and your stomach. And then white as a ghost, that's because the blood goes out of your face.
Right. Right.
So then, they know that post-traumatic stress and chronic stress can damage the brain. And a symptom of stress is difficulty with memory and difficulty concentrating.
Sure.
So that's a symptom of Alzheimer's too. Okay, then Parkinson's is pretty common. Parkinson's is low dopamine. You have to take L-Dopa to boost it.
Right.
Well, dopamine is a happy chemical. So when you get love, you get dopamine. Bad news stress turns off happy chemicals like dopamine. But the doctors aren't saying to the patients, hey, you have low dopamine. What's going on in your life? Do you have love? Do you have stress? They don't look at all that.
Yeah, it's almost like, so one of the concepts we've been talking a lot about in the environment, but also to include education, cyber defense, and a variety of other spaces, is this term ecosystem. And we usually only hear it when we talk about the environment, but in fact, it's a term that is very universally effective. And I think what you just described is both an ecosystem within the human of, if you have one problem, it creates another problem, and all of these actions then create these long-term issues. But there's also the ecosystem between the doctor and the patient and the human environment and the options for self-medication or exercise or healthy living, and that ecosystem as well. And it's interesting how they're all connected, right? This is a highly connected space.
Yes. So if the shift that I'm aiming for is if right now people go into the doctor and the doctor says, you have hypertension, so you should take this drug. It's a beta blocker and it blocks adrenaline at a cellular level. But they don't say, we're going to help you find out what is causing you stress so you can eliminate it. Like, I go home every day and me and my husband yell at each other. Okay, they're not going to help you with that. And then the kids are watching. Okay, so that leaves people stressing, and then everybody in their family is stressing because stress is contagious.
Yes.
That's
Yes.
another one of the things that I discovered in the literature is that stress is contagious. So when one person is tense and frustrated and angry and stressed, then they go to work and then they yell at their employees, or they go home and they're tense. Even if they're not yelling, they're tense.
Right.
They get upset easily.
So how do we fix it? Talk to us about some of the programs you're working on right now to put together to start addressing this and helping this message to get out. So I do think people are talking about it, right? This is not a completely new idea or new concept, as you pointed out. 50 years they've been standing on a soapbox saying it from a science perspective. More and more we're starting to see it in the media. People are definitely talking in the vet space. Really trying to open up and recognize the impact on the mind that extreme stress has when you're in theater, in the battlefield. But what we're struggling with, I think, is figuring out how to help people make these changes, because we all do. I mean, I break down as well and eat junk food. So I mean, we're most of us are guilty of this. And so the question really is, how do we start making that change? And I know you're making some efforts to connect people and to help share this message. So talk to us a little bit about that.
Okay, well, I have several initiatives. One is that I came up with this idea called the Health Project, which is a reality TV show. And just like the Pritikin program, in the Pritikin program, you live in a hotel for a month to exercise and eat right and reduce stress. And so I thought, well, let's create a TV show, have 100 people live in a deluxe hotel for a month and exercise and eat right and reduce their stress. And so that'll show 400 million Americans how to do that.
But we may have the same problem. They leave. How do they carry that on?
Well, if most Americans bring their stress down, then their happy chemicals will come on.
Right.
And so they won't be turning to junk food, nicotine, alcohol, and illegal drugs or caffeine. Okay. Caffeine turns on dopamine. It turns on happy chemicals. So we drink sugar, I mean,
I can say my tea does not have sugar in it, but it is green tea.
Yes, I know. I have my 2 cups of coffee every day, okay? Because I'm under a lot of stress. Yeah. We're all under stress. Just knowing, people do meditation and they do things to help them bring down the stress, and that's good.
Right.
That helps.
Right.
But if everybody is freaking out and they call you on the phone and they say, oh my God, I'm sick again, or I'm fighting, and then our leaders are constantly fighting.
Yeah, I mean, I think that's a major one to highlight right there, is that we have a lot of division happening in this country, and it's very interesting to be in the position I'm in, to be around people who will come up and talk to me. And I had one woman who really at hello said, I just want you to know I'm not racist. And I said, what? What prompted that? And she says, well, everybody on TV says that anyone who lives in our space is racist, and I'm not. And I said, okay, I don't even know you, so how would I? But it struck me that the defenses are so high and the stress is so high, and it's now a national stress. It's not just individualized anymore. She had taken on the arguments that are happening on TV that had nothing to do with her and nothing to do with me. But nonetheless, it was her immediate reaction. I thought, we have to all do a better job. All parties have to do a better job when people are feeling that they're being targeted. That's a concern. There's actually a research finding by Pew that said 50% of our country is physically afraid of the opposing party. Wow.
I believe it.
Wow, though. I mean,
yeah, it's
that's
coming.
Staggering. That's not just,
could,
hey, we disagree with each other. That's, I am afraid that someone will hurt me.
Well, in what I'm doing, I want to do a national discussion about this. Yeah. And so I've been contacting Dr. Dean Ornish and Dr. Andrew Weil and Dr. Oz, and communicating to them over the last 10 years and saying, we got to come together in a task force, speak to the American people, make an announcement.
Sure.
America, our country is in the grip of toxic stress overload. Mm-hmm. It's a contagious epidemic, and it's making us all sick and leading to an early grave.
I think you just summed it up perfectly there. So if we were to bring this together and think about 2 things that we could really highlight, and of course, from my perspective, what I'm trying to garner are, what are the 2 things that you think absolutely need to be in a national healthcare strategy? Something that we've really never thought about, right? It's not just thinking about whether or not you have an insurance delivery program. It's really thinking holistically about how we approach healthcare support in this nation. So if there were 2 points that you think would be really important to have, what would they be?
Well, number 1 is universal education for the doctors and the patients about stress and health and how stress is making us sick. Number 2 is right now we're spending $3 trillion a year on sickness care. So when people get sick, we give them drugs, we amputate their leg, bypass surgery. All these things are expensive. 10 years ago, Dr. Dean Ornish and Dr. Andrew Weil and Dr. Oz testified to the Senate and said, would you please help us shift some of the $2 trillion going into sickness care into healthy living programs and solutions? So Senator Tom Harkin was high fives, and hugs all around, but then he didn't do anything. And so now 10 years later, it's risen to $3 trillion. So I'm thinking since most illness is reversible with healthy living, if we spend $1 trillion on healthy living solutions, then we should save $2 trillion. So that would be like free gyms.
Okay.
When Ray Kroc's widow died, she gave $1 billion to the Salvation Army, and they built these community sports facilities with every kind of sport: baseball, basketball, gyms, dance, aerobics, skating, ice skating, just everything. And so in those communities, people got healthier, it created jobs. And there's no reason why we shouldn't be spending $1 trillion a year on building those and staffing those, because that's the alternative to spending $3 trillion on everybody's getting sick and dying.
I love it. I like the fact that you're also talking about building.
Yeah,
There's a
create
mantra
jobs.
Right. Well, and it's building from every angle, right? You're talking about building jobs, but you're talking about building Americans. You're talking about building readiness to handle those stressors that do come into our life by keeping people at a prepared level. And so building, I think, is actually much more difficult than tearing down or making goals. Building requires us to create those pathways and create the ideas that you just described and find places that are working. I would love for you to share with us the community that you just discussed, if you wouldn't mind sending that, because I will go ahead and attach it to this video so that people can read about that program as well. And with that, I think we'll go ahead and close out.
Okay.
Thank you so much to everyone for joining us. This has been, I know we had a little bumps and bruises in the beginning, but I think once we got into it, it's some really nice points to highlight. And I am passionate about this preventative space and making sure that we do really think proactively for our country rather than constantly have to deal in that reactive space. One of the recommendations when I used to see patients that I would say to them as a metaphor, I said, it is always easier to never go into debt than it is to pay it off, because when you pay it off, you do so with interest. And it is the same point, whether you're talking about parenting children, whether you're talking about gaining weight, whether you're talking about getting sick, or any other procrastination space. So I think when we can think about that, we end up being, as to your point, far more efficient in our expenditures because we're not paying with interest, but we also are far more effective in our health system and our healthcare as individuals because we're dealing with it ahead of time. Thank you so much, and we will see you on the next one. Thanks, Chris.
Thank
for joining
you.
us.
I enjoyed it.
Me too.
Bye.
Bye-bye.